Hi everyone, Colleen here, and welcome back to bALS. This week I'm going to talk about the merits of speech therapy. Now, last year, my troubles with the slurred speech was very concerning to me, and I was very lucky to have a neurologist that was really listening to my concerns. So, after several months of trying to find the cause of my slurred speech, she had sent me to speech therapy. I'm very thankful for that, and I'm very thankful for my speech therapist who was also very listening to my concerns and gave me exercises to help with my speech, but also for the other things I was concerned about, some choking issues, some trouble swallowing, some breathlessness, everything I complained about. She had given me some exercises to strengthen those muscles. So, even before I had the diagnosis, I was given these exercises and I've been doing them. At one point, someone even came up to me and asked me why I was going to speech therapy because my speech was still pretty coherent. And I told them that the speech therapist was helping me with other things like my choking and my swallowing and my breathing. So it wasn't just about being able to enunciate my words, but other things that the speech therapist was helping me with. So I have continued these exercises that I had gotten before my diagnosis, and even after my diagnosis, I've continued those exercises. And for me, I'm very thankful for that because I feel it has helped slow down the progression of my disease. So many people are very quick to dismiss speech therapy. And this really confuses me because I'm living proof that my speech therapy is helping me. And so many people are saying that speech therapy does not work, not to even bother with speech therapy, until one day somebody said the magic phrase, "It cannot rebuild those muscles." Of course not! This is a progressively degenerative disease. You cannot rebuild these muscles. This is not an injury or a surgical procedure where you can go to therapy and expect to become whole again. This is a progressive disease. This is ALS. You cannot rebuild those muscles. That's just unrealistic. You're not going to see a limb onset patient lift a few weights and expect to regain full motion of their arm. Why would anybody with a bulbar onset expect speech therapy to bring them back to whole again and help them speak like they did before, or suddenly become able to swallow their foods? It just doesn't work that way. So, what is the merit of speech therapy? Well, for me, the speech therapy helps to keep my muscles as strong as possible for as long as possible. I want to slow my progression as much as possible. And that's what speech therapy does for me. I was lucky enough to start it right away in the early phases. My slurred speech was a concern for me right off the bat. And I've been given these exercises long before I've been given my diagnosis. So at that stage of dysphagia and slurred speech, my neurologist had the foresight to send me to a speech therapist. Now, I acknowledge that there are some people out there who, by the time they get their diagnosis, their progression is already gone past a certain point, and their deterioration is already at a bad state, that they're not able to speak or swallow very well by the time they get their diagnosis. And at that point, there's very little that can be done when you already have that level of deterioration. I also acknowledge that some people are following doctor's orders, and this really upsets me to hear stories that people have been told by their providers. Their providers are telling them not to exercise. The providers are telling them to wait until they're at a certain level of deterioration before they do anything. And this, personally, it upsets me greatly because, for me, I see the benefits. And it's difficult for me to know that some people are being told to sit around and do nothing. And by the time they get to do something, it is a little bit too late. So I think it's very, very important to start early. For me, I wish that providers would encourage these exercises that I'm showing early on, early in the slurred speech, early in the dysarthria stage, just to help people with their speech, or people having swallowing problems without even having a diagnosis of ALS, still getting the opportunity to strengthen those muscles. So I also think it's important for my brothers and sisters with the limb onset ALS. They know that this is coming. They know that it will reach a bulbar area, so they know it's coming. And I think it's important for them to start the speech therapy early. My goal in all of these videos on my bALS site, my goal of all these videos is to help people who are newly diagnosed with ALS, a bulbar ALS, to help slow their progression. And my goal is also to help those with the limb onset ALS prepare for what is yet to come. I really want to encourage people to keep as strong as possible for as long as possible in order to slow the progression of the disease. And I hope that through all of this, people share the word and encourage others to stay as strong as possible. So once again, I want to thank you for watching and being a part of my journey.